Did you know that your health is inextricably linked to the health of a fruit bat in a tropical rainforest or the soil quality in a distant farmland? We often view human medicine as an isolated field, but the One Health movement is shattering that illusion. It's a revolutionary framework proving that we cannot have healthy people on a sick planet. From emerging viruses to antibiotic resistance, everything is connected. Today, we dive into why this interdisciplinary approach is our best defense. The One Health movement isn't a new concept, but it has gained critical urgency in the 21st century. It is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. By bringing together doctors, veterinarians, ecologists, and policymakers, One Health recognizes that the barriers between species are porous. As our global footprint expands, understanding these intersections is no longer just a scientific pursuit. It is a requirement for our collective survival and future stability.
Welcome to Health 600's Noble Science in 600 seconds. Your life-changing 10 minutes. Let's go!
Chapter 1: The Trinity of Life. The One Health movement rests on three fundamental pillars: human health, animal health, and environmental health. Historically, these fields operated in silos. Doctors treated patients, veterinarians cared for livestock and pets, and ecologists studied the wilderness. However, the 21st century has taught us that these silos are dangerous. When a forest is cleared for urban expansion, wildlife is pushed into closer proximity with humans. This displacement creates a bridge for spillover events, where pathogens jump from animals to people. Similarly, the chemicals we use in industrial agriculture don't stay in the soil. They enter our water systems and affect both aquatic life and human biology. One Health argues that we must treat the patient as the entire ecosystem. By monitoring the health of migratory birds or the quality of our groundwater, we can predict and prevent human health crises before they even begin. This holistic view is the foundation of modern biosecurity and truly sustainable global wellness. Chapter 2: Zoonotic Diseases and the Spillover Effect. Perhaps the most urgent driver of the One Health movement is the rise of zoonotic diseases, illnesses that jump from animals to humans. Statistics show that roughly 75% of emerging infectious diseases in humans have an animal origin. Think of Ebola, SARS, MERS, and most recently, COVID-19. These are not random acts of nature. They are often the direct result of human interference in animal habitats. When we disrupt the natural balance, we remove the buffer zones that have kept these viruses contained for millennia. The One Health approach changes the narrative from reactive to proactive. Instead of waiting for a patient to show up in an emergency room with a mysterious fever, One Health practitioners are in the field. They are testing bushmeat markets, monitoring livestock in intensive farming operations, and studying the viral loads in bat colonies. By identifying these threats at the source, the animal-human interface, we can develop vaccines or implement land use policies that prevent the spillover from ever occurring. Furthermore, this movement highlights the sentinel role of animals. Often, wildlife or domestic pets are the first to fall ill when an environmental toxin or a new pathogen enters an area. By paying attention to these canaries in the coal mine, public health officials gain a crucial early warning system. This collaborative surveillance is the only way to stay ahead of the next pandemic. It requires a massive shift in funding and communication, moving away from sick care for individuals and toward health care for the planet. When we protect the health of a primate in the Congo or a pig in a factory farm, we are directly protecting the family living in a city thousands of miles away. Connection is the reality of our biological existence. Chapter 3: The Silent Threat of Antimicrobial Resistance. Beyond the headlines of viral pandemics lies a slower, equally deadly crisis: antimicrobial resistance, or AMR. This occurs when bacteria, viruses, fungi, and parasites change over time and no longer respond to medicines, making infections harder to treat and increasing the risk of death. One Health is the primary framework for tackling AMR because the problem is fueled by every sector. In human medicine, the overprescription of antibiotics creates resistant strains. In agriculture, antibiotics are often used not just to treat sick animals, but to promote growth in healthy livestock living in cramped conditions. These resistant bacteria then enter the environment through animal waste, contaminating soil and water. When you eat produce washed in this water or live near these farms, you are exposed to superbugs that modern medicine may not be able to kill. A One Health strategy addresses this by advocating for stewardship across the board. It encourages farmers to improve animal welfare to reduce the need for drugs, pushes for better waste management systems to prevent runoff, and educates the public on the proper use of medications. If we only focus on how doctors prescribe pills while ignoring how industrial farms dump waste, we are fighting a losing battle. The One Health movement recognizes that the efficacy of our life-saving drugs depends on a global agreement to manage how we treat all living creatures and the environments they inhabit. We cannot save ourselves without saving the system. Chapter 4: Environmental Integrity and Human Longevity. The third pillar of One Health, the environment, is often the most neglected, yet it provides the very infrastructure for life. We often think of the environment as a nice-to-have or a place for recreation, but One Health repositions it as a critical component of clinical outcomes. Climate change is a primary example of how environmental shifts trigger a cascade of health issues. As global temperatures rise, the geographical range of disease-carrying insects like mosquitoes and ticks expands. This brings diseases like malaria, dengue, and Lyme disease to regions that were previously safe. Without an environmental perspective, a doctor in a temperate climate might misdiagnose a tropical disease because they aren't factoring in the ecological shifts occurring outside their clinic doors. Furthermore, the loss of biodiversity weakens the dilution effect. In a diverse ecosystem, a virus might circulate among many different species, some of which are dead-end hosts that don't pass the virus along. When we destroy biodiversity, the species that remain are often those most likely to harbor and transmit diseases to humans, such as rodents. The One Health movement also addresses the impact of chemical pollution and microplastics. These contaminants don't just exist out there in the ocean, they bioaccumulate. Small organisms eat the plastic, larger fish eat them, and eventually, these toxins end up on our dinner plates, affecting our endocrine systems and long-term health. Urban planning is another frontier for One Health. Integrating green spaces into cities isn't just about aesthetics, it's about reducing urban heat islands, improving air quality, and providing ecosystem services that lower stress and improve cardiovascular health. By protecting the integrity of our air, water, and soil, we are essentially investing in a global health insurance policy. The movement advocates for nature-based solutions, where we use the planet's natural processes to solve human health problems. For instance, restoring wetlands can naturally filter water, removing pathogens and heavy metals more effectively than some man-made plants. When we view the Earth as a living organism of which we are a part, our approach to policy, industry, and daily living transforms. We stop seeing the environment as a resource to be exploited and start seeing it as the very foundation of our longevity. We are only as healthy as the world we breathe in. Chapter 5: A Collaborative Future. The One Health movement is more than a scientific theory. It is a call for a radical shift in how we inhabit this planet. It demands that we break down the walls between government agencies, research institutions, and local communities. A physician in London must be able to communicate with a wildlife biologist in the Amazon and a soil scientist in the Midwest. This level of cooperation is our only path forward in an increasingly crowded and interconnected world. As individuals, we can support this movement by making conscious choices, reducing our carbon footprint, supporting sustainable agriculture, and advocating for policies that prioritize ecological health. We must recognize that our well-being is mirrored in the health of the stray dog on the street, the quality of the river flowing through our town, and the stability of the global climate. In the end, there is no us and them. There is only one health. Don't just watch, take action right now. I have already shortlisted the exact products and tools you need to secure your results. Scan the video description below to get your protocol hardware today.
This is Health 600s, and I'll see you in the next 600 seconds.
Thank you for watching. Comment, like, subscribe.